Chain Drug Review, and Mass Market Retailers Video Forum. Brought to you by the Emerson Group.
Hello everyone, I'm Jeffrey Wolt, Editor-in-Chief of Retail Media IQ. Welcome to our video forum. Today we're thrilled to have Dr. Marc Watkins, Chief Medical Officer of Kroger Health, with us to talk about RSV. Great to see you, Marc.
Yeah, great to see you, Jeffrey.
Immunization season is in full swing, and for a long time people have been accustomed to getting flu shots, and I think the memory of COVID still has them lined up to get COVID shots. But RSV is often overlooked. Maybe you could just start by telling us what RSV is and why Kroger is making it a priority to inform the public about it.
Yeah, it's a great start. And again, thank you for having me. This is such a great opportunity for us to begin talking about something that's very important. So RSV, otherwise known as respiratory syncytial virus, it's a virus that can cause an infection, very similar to what we would see for folks that had a cold. So runny nose, congestion, coughing, sneezing, fever, and some wheezing. It's usually in mild cold-like symptoms, and most times it goes away on their own, but it can be very serious for babies, young children, and older adults. And so that's why we've been talking a lot about when it peaks. It peaks in December and January, and so we're right in the middle of it. And again, right now there is no treatment for RSV, but you can manage the symptoms with over-the-counter medications. But there are some things that you can do to really help you to prevent the spread of RSV, and we'll get into that as we go through our conversation.
Mm-hmm. And Marc, just for my own information, how serious can RSV become in the age groups that you cited?
Oh, very severe. It could essentially create a hospitalization. Some become very ill, and some could potentially die from this infection. We really see a lot of that happening in very young children. Older adults are those that have suffering with immunosuppression, right? They don't have an intact immune system, and that could be very serious.
How is the virus spread?
It can really spread much similar to the way that the cold, our cold or a flu can spread, right? It spreads through coughs or sneezes or by direct contact with someone who has RSV. Most people that are contagious, they can be contagious for 3 to 8 days, and really can even start 2 days prior to them actually showing signs of illness. And so things like touching dirty surfaces, not covering your mouth or nose when sneezing can further increase the spread. And then being in close proximity with one another, as these are winter months, we're spending time indoors, it's a holiday season, so folks are in close proximity, and those that are having symptoms obviously can spread that to family members, loved ones, and others.
And how prevalent is RSV?
This time of year, it's very prevalent, meaning that it is around, much similar to the way that cold and flu is around. We know that it's part of an endemic, or it's part of one of those seasonal respiratory viruses that it's part of our landscape. So protecting yourself against this is similar to the way that we recommend protecting yourself from influenza by taking an influenza vaccine, right? So there are vaccines that are available for RSV, and it's recommended for all adults ages 75 and older, and adults ages 60 to 74 who are at increased risk of severe RSV. RSV, if you're at increased risk, you should be talking to your healthcare professional, pharmacist about is this the right vaccine for me?
Are there other steps that can be taken above and beyond the vaccine to help contain the spread of the virus?
Absolutely. That's a great question, Jeffrey. Yeah, things that you can do, right? So covering your mouth, nose, if you're sneezing or coughing, stay home if you're sick, right? That's another easy way. You can't spread it if you're away from others. Frequently washing hands, right? Making sure that you wash your hands. Cleaning dirty surfaces or frequently touched surfaces can be another way that we actually can slow down the spread because these types of viruses can last on surface areas for hours on hard surfaces. And so things like doorknobs, handrails, car doors, things that are frequently touched a lot, especially things in public places, right? So keeping some hand sanitizer with you is a good step. In addition to these, and we heard about these types of non-pharmaceutical interventions, right? These NPIs during COVID. It's also important that you protect yourself with a vaccine if you are eligible, right? So those are some of the things that you can do um, um, in order to protect yourself against RSV.
Mm-hmm. And I'm sure you would agree that pharmacy is perhaps the most convenient and efficient place to obtain an RSV vaccine or really any vaccine.
Absolutely, right, and that's an excellent point, right? So the pharmacists are both not only credible, but incredibly knowledgeable about vaccine administration, age groups, those that are what recommendations are out there, and they're widely accessible. That's one of the things that make them, in my opinion, sort of incredibly useful in handling not only during the public health emergency, what we saw during COVID around just the total amounts of vaccines given, but they're expert and incredible in terms of being able to really have those conversations with their patients about which vaccines are right for not only that individual but that family.
And Mark, maybe for a final question, you could tell me what are your pharmacists reporting to you in terms of people's knowledge about RSV and their willingness to say, okay, give me a third shot instead of just flu and COVID? Is there ever any resistance like how many vaccines do I need?
Right, and that's another great question. I think that's a conversation between patient and pharmacist. I think that's the value that's created by having those conversations. So you can have your questions answered. They can review your health history, and then they can determine what risk you have. Right. A good example might be Jeffrey that you had someone at home that's dealing with a severe illness. You can protect yourself, but also protect that person at home by actually getting a vaccine as well, and especially an RSV vaccine that can also help. But really having that conversation with your pharmacist, healthcare professional, but again, our pharmacist and any community pharmacist can really help. But I like to think our Kroger pharmacists can do a great job as well.
Absolutely. Mark, this has been great. Thank you for your time today. I appreciate it.
Great. Thank you for having us.